Thank you, Madam Chair and members of the board. My name is Nathan Fletcher. I'm a resident of the community of City Heights. And as outlined, we have a serious mental health crisis in our region for a variety of factors. Those of us who followed this issue closely are particularly concerned by the series of events on the horizon that are going to cause a catastrophic situation as it relates to inpatient psychiatric care. I think your effort to launch a 90-day assessment is good, and I support it. But it cannot be focused on identifying the problem. We know what the problem is. It has to be focused on identifying the solution and, more importantly, to bring the various stakeholders to the table to agree on a concrete series of steps you can take that will truly identify and solve this problem. Everyone has to be a part of the solution. The state has to be a part of the solution. There are real problems with those deemed mentally unfit to stand trial that are then returned into county care. But your assessment is going to have to bring in legislative leaders. It's going to have to bring in the governor. It's going to have to bring in relevant state agencies. You're going to have to get real commitments and concrete steps. I've passed major healthcare legislation at the state, and it's possible, but it's not easy. And it's going to take a lot of hard work and a lot of coalition building. The federal government has to be part of the solution. You have to get action to make sure Medicare reimbursement rates are provided for standalone mental health care facilities, not just hospitals. We've seen members of the Board of Supervisors, have meetings with the President in the White House. Have a meeting on this. Get federal action. Get your congressional delegation involved in providing federal flexibility so that you can do this. The hospitals have to be a part of the solution. They can't hide behind construction costs and timelines to not provide a critical, vital public service. Particularly those hospitals that form the role of a public health district. They have an obligation to provide care. But we have an obligation to bring them together to figure out how we get there. And lastly, the county has to be a part of the solution. Not just in conducting a 90-day assessment, but there are immediate actions and steps you can take now, before your assessment is complete, to set the framework for a longer-term solution. The county could offer Tri-Cities the $3 million they need to make the upgrades on their ceilings so they don't lose their JCAHO accreditation and standards, and then demand that they stay open. This would provide a continuation of those beds. Your facility at Rosecrans is licensed by the state of California for 109 inpatient beds. You currently are operating at half of that capacity. Staff it. Open the beds. Get that done now. You don't have to wait for a 90-day assessment. Those two actions alone would bring up almost 80 inpatient psychiatric beds that could help provide the foundation for the longer-term solutions you need with the state and federal government. In closing, I'll tell you that the County of San Diego has a moral obligation to lead on this issue, and it's going to require leadership and collaboration and action, and our region needs it now. Thank you.
Thank you. Next speaker.